bitches.
Get them off! Get them off! Get them off of me! Get them off!
There's nothing there, Elise. There's nothing there.
Oh, this is getting ghost chili spicy. Her symptoms are what we call delusional parasitosis, which has been nicknamed worms of the mind. It's a psychotic illness leading to fixed false beliefs about being infested by an organism or parasite. I've actually seen a patient with this recently. Very excited to react to House MD Season 1, Episode 7. Let's see if I can get the diagnosis before House does as a doctor working in London. On this channel, we're reacting to all 177 House videos, and this will be number 27. No time to waste.
How are things with Elise?
Great.
Great?
Yeah.
One-syllable answers, you're rather out of breath, you're lying to me.
Okay, seems breathless on the run. Could be asthma or a chest infection. Maybe he's had foreign travel recently and picked up atypical pneumonia. Or it seems like there's some questions about his marriage. Maybe he's developed an STI or HIV. Maybe he's sleep deprived from having a kid, as I'm about to be very soon. Let's find out more. It's all quite vague right now.
It's almost 4.
Call Jacques. Tell him I'm not feeling well.
It's Saturday. Haven't been to work in 3 days, remember?
Stop! Leave me alone!
I think there's something wrong with me.
Strong opener. So this patient has been in bed for 3 days, losing track of time, feeling impulsive and aggressive with her husband. Sounds like she's suffering from a terminal condition called marriage. But seriously though, it seems like they're pointing towards a psychiatric diagnosis. This episode is called Fidelity, so maybe promiscuity is involved, which is associated with either mania or borderline or emotionally unstable personality disorder. I'd say the former is more likely because it's reversible. The obvious cause of swinging between mania and her symptoms of inactivity could be bipolar disorder, but what could be more interesting is secondary causes of mania or toxic psychosis. HIV or AIDS could cause it, and that would fit with the Fidelity name of the episode. Steroid, excessive caffeine use, according to a study I saw of a 43-year-old man who was drinking 10 cups of coffee a day and then developed grandiose symptoms with flight of ideas and irritability, needing hospital admission. Nobody loves coffee that much. Also recreational drugs like cocaine or amphetamine or some others, heavy metals, arsenic, organophosphates, ethylene glycol have all been noted to cause toxic psychosis. Let's find out more.
She's irritable and sleeping 18 hours a day. Fever.
Clinical depression does not cause fever.
Elevated sed rate indicates inflammation.
It has to be a tumor then. Redo the blood work and get a new MRI with 2mm cuts through the mesodiencephalic.
New blood work? Do you mean we're finally going to be blessed with blood results? I've been waiting for this moment. Cameron mentioned blood and CSF showed no sign of parasites. Now, it seems like this patient has been extensively investigated already by other doctors, including radiologists, but House wants to repeat scans to make sure. He thinks it's a tumor and that maybe the slices that the previous head scan took were too far apart, so they could have missed a small tumor sitting between the slices. One inaccuracy here though is he mentions the mesodiencephalic, which if there were a tumor present there, it would likely cause spinocerebellar ataxia, which she doesn't have. The sleep center of the brain actually is located in the hypothalamus, so I'd probably want more detail there. It seems now though that her main symptom is hypersomnia, not low mood, so I wonder if she could have African sleeping sickness. Because of that focus on parasite that they mention, she hasn't traveled, but maybe she's cheating with someone and that has passed on to her. It would fit the story and the symptoms. Let's find out.
There were no lesions and no mass effect that we could see.
I don't feel good.
She's seizing! Get on her side. I need some Ativan! Come on, Elise.
Okay, medical dramas love giving benzodiazepines so early during a seizure. The patient was seizing for less than a minute and Cameron was giving Ativan, which is lorazepam. Giving benzos before 5 minutes actually is not recommended because it suppresses the body's autonomic response and aggravates cardiorespiratory compromise from the seizure, doing more harm than good. Either way, there's definitely a neurological component to her symptoms now, which is confirmed by the seizure. African sleeping sickness can definitely do this after the parasite Trypanosoma Brucei crosses the blood-brain barrier. To test for it, you would usually do a blood test called the card agglutination trypanosomiasis test, or visualize on microscopy. You should usually be able to see it in CSF as well, but maybe the CSF test was too early as it hadn't been in the blood-brain barrier yet. Treatment would be with nifurtimox and eflornithine based on recent guidelines. Speaking of pathogens, I've got a question for you smart people. How many different types of bacteria can you name off the top of your head? Winner gets a shout out in the next video. Put your answers down below.
Did you look at her breast? It could be paraneoplastic.
Does she have any family history of breast cancer?
Her mother died of it.
We've been trying to get pregnant for over a year. Guess we're lucky we didn't.
Oh, the oncologist is suggesting breast cancer. I like seeing Wilson being a lot more involved here than later in the show. I wonder why that is. I guess we'll find out. Now, breast cancer is a very unusual cause of paraneoplastic syndromes, which is what Wilson was talking about. Usually it's small or squamous cell lung cancers that are notorious for it. There have been some neurological paraneoplastics with breast cancer though. Examples are cerebellar degeneration, sensory motor neuropathy, some retinopathy, stiff person syndrome, encephalitis, and opsoclonus myoclonus syndrome as well. I don't think this is any of them though. I think their problems with fertility pushed her to cheat and get hold of this infection, which is now in her head. Another House-esque crazy thing it could be is if she has androgen insensitivity syndrome and is a genetic male, and that's why they can't have kids. Imagine that.
No tumor?
The MRI and the mammogram only showed a few benign calcifications.
It's most likely a small cell tumor. It's no surprise we're having trouble finding it. We should do a PET scan. Start with her lungs.
What? You can't find it because it's a small cell tumor. Small cell doesn't mean small tumor. You see, when looking under the microscope, if anything, a small cell would actually be very aggressive and fast growing. So if it was bad enough to cause her symptoms, you'd definitely be able to find it, since she's been investigated more than Amber Heard.
Treat the symptoms. IV immunoglobulin. One of you needs to check out where she works.
I use the same detergents for 15 years and everyone is healthy as a horse. Whatever Elise has, she didn't get here.
So the husband's not sick, none of her colleagues are sick. She's a rôtisseur, prepping the most roasted meats and gravies. Maybe she went abroad to find the best cuts of meat, and that's when she got her parasite. You may be thinking, why is he so focused on a parasite? And it just fits so well, especially considering the fever. Also, other causes don't quite fit, like cancer should have shown up already. Metabolic usually would have other symptoms like leg cramp if the sleeping disorder was this bad. Sleep apnea would be sudden onset, the husband would have noticed, and she's actually normal weight. Psychiatric would be just too boring and it wouldn't cause fever, and it doesn't really explain the whole story. Toxins possible, but no clues yet as to what it could be, and no one else is sick. As you can see, my mind is about as open as Area 51. Now, if you're open to some good perks, you should check out the channel membership. Currently, the Hall of Fame is open, which means our first 10 channel members will have their names etched into the channel forever, and there are only 4 spots left. Once it's full, we'll be doing a members-only live stream Q&A. And members get special perks like suggesting what I react to every Saturday. The earlier you join, the earlier I can make your suggestions, and you're also helping me create better reaction videos with your support. So click the join button now to get involved.
It really itches.
Oh my God, get them off! Get them off of me! Get them! Get them off!
There's nothing there, Elise. There's nothing there.
Oh, this is getting ghost chili spicy. Her symptoms are what we call delusional parasitosis, which has been nicknamed worms of the mind. It's a psychotic illness leading to fixed false beliefs about being infested by an organism or parasite. I've actually seen a patient with this recently, came to my clinic saying that his house was infested with bugs. Initially I thought it was real, but then I asked him to draw what the bugs looked like and he drew mosquitoes in London in the middle of winter. That's when he also told me they were laying eggs under his skin and I realised he was taking heroin. It's also called Ekbom syndrome, named after Carl Ekbom, who was a Swedish neurologist who first fully described the condition in 1938, although there were brief descriptions before that. In Ekbom's paper, they hypothesized that the first person to suffer with the condition was someone called James Harrington, who said that he could imagine his sweat turning into flies. Now, delusional parasitosis is very different to fornication, which sounds similar but is again very different to fornication. Formication is a feeling of an insect crawling on the skin even when there's nothing there. It's because of peripheral nerves and it triggers a scratch reflex. Sometimes static electricity can trigger it too. Oh, I'm feeling quite itchy now. Where's the bug spray?
Maybe she really has bugs under her skin. In the final stage of African trypanosomiasis, almost all the parasites are inside the brain.
Rabbit fever fits or symptoms.
Oh man, House mentioned African sleeping sickness, but now they're not investigating because she's never been to Africa. Come on, what happened to Everybody Lies, House? Do the test, please, otherwise I'm going to die of curiosity. Before the patient. They're leaning towards an infection because they gave her intravenous immunoglobulin, which is a type of immunosuppression, and she got worse. Instead, now they're investigating for rabbit fever or tularemia, which she could have gotten from work. It's a type of bacteria that they're wondering if she's inhaled. Interestingly, the bacteria is known as a category A bioterrorism agent because of its low infectious dose and high mortality rates. To test for it, you'd have to do antibody tests, culture, or PCR, and treatment could be with strep or gentamicin. Let's see, come on marital affair, reveal yourself.
Lab tests inconclusive. Luckily, I have the answer. Sex. Anything that can be transmitted via the blood can be transmitted through sex.
Sleeping sickness from sex.
You want me to ask a man whose wife is about to die if he cheated on her?
Okay, much easier than dragging the truth out of the family is to test for sleeping sickness. But where's the fun in that? I also love what's happening here. The writer's making it essential to discover the truth, to be able to treat the infection. Part of that is they're saying that the treatment for sleeping sickness has a 1 in 10 mortality rate, which is also not true, but makes things even spicier. If I'm right and it is African sleeping sickness, I called that so early. Would be the second only time that I got the diagnosis. Also, who cheated? The wife or the husband? Question for you smart people. And what percentage of married couples stay together after cheating? Put your predictions down below.
Actually, I don't want you to ask her anything. Foreman, take the husband, Chase, take the wife. Did you know she's been trying to get pregnant?
Yes.
After you got so freaked about the sick babies a while ago, I figured that was your thing.
Wow, love the continuity between episodes here. In season 1, episode 4, maternity, Cameron had to tell the parents of a critically unwell child that he was likely going to die and ended up telling them that he was getting better before the child actually passed away. House now thinks that she was trying to get pregnant and is very sensitive on that area, so doesn't trust her to do this task of exploring the infidelity of this married couple. Seems like we're about to find out the real reason why Cameron is so sensitive about this. As doctors, we're duty-bound to treat everyone equally, but it's hard not to relate to some cases more than others, especially if you or a family member have suffered from the same thing. Sometimes, though, we can use that to help build trust. Like, for example, I previously had a sty on one of my eyes, and a patient came to see me recently who was apprehensive about warm compresses for sty and wanted surgical treatment straight away. It wasn't until I told him that I had the condition myself and treated it without surgery successfully that he trusted my advice and agreed to actually try it. Even though I've also treated many other patients the same way, him knowing that I specifically had been through it made a difference. There is something emotionally hardwired in us humans to trust other people's experience of what helped them more than the evidence, even though logically that shouldn't be the case. And that causes a big problem when those two things point to different treatment options.
But you've never been prescribed folic acid. You can't lose a baby if you've never been pregnant.
You pulled my medical records?
You coughed the other day. I was concerned.
You were curious, like an 8-year-old boy with a puzzle that's just a little too grown up for him to figure out.
Oh, these back and forths are way too good. Folic acid is a supplement women need to take at least 3 months before pregnancy, ideally. That's because it helps support the baby's neural tube development and prevent conditions along the spina bifida spectrum, which happens when the neural tube doesn't close properly. So in theory, if Cameron was trying to get pregnant, then she would have been given some of them. That's another piece of the jigsaw that we haven't quite figured out yet.
They say no cheating, we cross off sleeping sickness. Any new ideas? Okay, we go with Foreman's tularemia. Start her on IV chloramphenicol, 25 milligrams per kilogram 4 times a day.
She's in a coma.
Okay, clearly the chloramphenicol didn't work. She's now in a coma. How much do we need to push the husband to get the truth? He said he wouldn't cheat. He said he loves his wife, but I sense some apprehension on his face. Also, he's an all-star actor, so he must be building up to an epic monologue of some sort. Yeah, that's right. I'm basing my medical decision on the epicness of a patient's relative. That's what we need to do to get the diagnosis before our house. Well, hopefully.
Your wife has human African trypanosomiasis, sleeping sickness.
I've never had an affair. Why would she lie if she knew it could kill her?
You trust your wife that much? I'll start the treatment.
Oh, the husband had a tough call on this one. Either agree to the treatment or face the possibility she was unfaithful to save her life, but face a risk of 1 in 10 of death, or decline the treatment because he had absolute faith in her loyalty. Could anyone decline in that situation? House is saying he needs consent since the drug can be so toxic. The drugs used here would likely be nifurtimox or eflornithine, as I said before, according to latest guidance, and severe adverse drug reactions would be present in less than 1% for those. There is a really fairly dangerous old drug that's not used very much anymore that I suspect House might be talking about. It's the closest one to 1 in 10 mortality rate. It's actually got 1 in 20 mortality rate called melarsoprol, which puts this option in the realms of medical fiction, but I'm loving how the writers make these tough situations so interesting to watch. Now, is she a living cheater or will she die by her faithfulness?
The special IV tubing.
Why do we need this stuff?
Because melarsoprol melts plastic.
If she gets better, it means she wasn't always there for me.
Oh, let me tell you that thankfully they've discontinued this drug for most cases because it's exactly as he said. Arsenic mixed with propylene glycol, which is used in antifreeze, called melarsoprol. Propylene glycol doesn't exactly melt plastic, and according to the World Health Organization, plastic syringes can be used as long as it is drawn up and infused quickly, as some plastic syringes can show signs of wear after coming into contact with melarsoprol. The main way it causes mortality in 5% of cases is encephalitis, so it's always co-administered with prednisolone to reduce the risk of that happening. Now, they can actually still use this today in very rare cases where recurrence of infection happens after first-line treatment. That's because the first-line agents aren't as dangerous as melarsoprol, but nothing has been shown to be as effective as it because it kills 95 to 97% of African sleeping sickness. It's just an inconvenience that it also happens to kill the patient. That's without mentioning the side effects: nausea, vomiting, neuropathy, including quadriplegia if left untreated, and severe pain and local reactions. Nasty drug.
When I was in college, I got married. It lasted 6 months. Thyroid cancer metastasized to his brain. I watched my husband die.
But you knew he was dying when you married him.
Wow, we're really finding out about Cameron's backstory here, and House has hit the nail on the head. Thyroid cancer usually would be diagnosed more than 6 months before the patient's death, so she would have fallen for him while he was already diagnosed. She must have wanted to look after him. Interesting, because the husband to our patient in this case, who also happens to be the brother from Prison Break, Dominic Purcell, said that he doesn't want the patient to get better because that means she cheated on him. He asked Cameron if that makes him a terrible person, and she said yes. This episode is pure savagery. So was House going straight in with the line, "You knew what you were getting into when you married him." Grade A sensitivity. Anyways, I can't stand this tension. I need to know if she makes it or not.
Killing the parasites isn't going to do much good if we kill her heart at the same time.
We would have expected your wife's condition to show some improvement by now.
Please don't die.
No way! This is insane! Guys, I cannot believe how early I managed to call this one. African sleeping sickness and the mode of contraction as well. You see, now you have to be a member. There's no other choice. I will take that. Hell yeah. That is just crazy. I can't believe it. Also happy that she's alive, of course. I'm a terrible person. This means she did cheat though. Very interesting.
He's away.
What she did. Can't love a person and do that to them.
I need to know who you had the affair with. We all make mistakes. And we all pay a price.
How you doing?
Fine.
Can I help you?
Wow, she was willing to die to hide her infidelity. Crazy. The celebration when she came back to life was very short-lived. But what's even crazier is not only was she unfaithful, but the guy she was unfaithful with is her husband's best friend that he was running with at the start. Now you'll have to see what happens in another one. Stay curious.